Diversity in healthcare isn't just a slogan. For some patients, it can mean the difference between life and death. We found a program focusing on future healthcare providers who can bring their different ways of thinking into the healthcare field. Paula Tutman was there for graduation today. She joins us live from downtown Detroit. Hi there, Paula.
Hey, Karen. So there are no short-term fixes for these kinds of shortages. We all know that. But this kind of long-term future investment is so multifold because it also addresses shortages in diversity. When you treat a patient for an illness, the way you treat cultural differences is equally important. And that's just one reason having a culturally diverse medical force is critical.
From the patient's perspective, when they're interacting with a physician or a nurse practitioner, they want to make sure that folks understand their culture, but more importantly, respect it and respect the decisions that they make and how the culture shapes their experience with health and health care.
Dr. Martina Caldwell,
Hey, Brother Will, you're looking great.
the medical director of diversity and inclusion for Henry Ford Health, doesn't just talk the talk. She's done the walk.
My only exposure to healthcare was from the side of my family being sick, and I wanted to be a change agent. I said, well, I feel helpless, right, watching my family interface with healthcare in a way that didn't feel authentic to us, didn't always take care of our needs. And so I wanted to be one of the physicians on the other side doing the service.
And from her own experiences, developed the Pathways to Healthcare Clinical and Research Careers program. Long name that in short took 16 minority high school students who for the last 4 weeks have been getting immersed in the possibilities of themselves in healthcare fields.
I definitely got to meet a lot of diverse doctors, and I was really happy with that because I didn't really think that there would be a lot of people our skin color in this field.
Like rising sophomore Jada Hill, who wants to be an OBGYN and actually got to watch babies being born.
Well, I love babies, so seeing live baby births was really awesome to me.
The program is as intensive as it is intentional.
This summer, these students had a ball. They also engaged in simulations where they learned how to suture, do robotic surgery and ultrasound. They are CPR trained. They shadowed clinicians that look like them and do the careers that they aspire to.
And by guiding these students from Detroit and surrounding communities through what it's like to be a part of the medical community, it sets them on a pathway of making a difference because of who they are.
So it's incredibly important that sometimes when patients come into a building in their most vulnerable times, that they see folks who look like them. They see folks who might understand what they're going through. They see folks who understand some of those cultural nuances.
Okay, so how's that for what you do on your summer vacation? So this inaugural graduation class, again, this is absolutely huge for them, but it doesn't stop there because we also know that minority students have a lot of issues very often in getting funding for higher education. And so the program actually follows these students and helps them learn how to apply and navigate them through funding. And also, Jada got to watch babies being born. And that made it worth, right?
Such a great
What did you do for your
right?
summer vacation? I watched babies being born.
Pretty darn cool. I love the story, and obviously such an important topic as well, diversity being injected there. All right, Paula, we appreciate it.